afternoon, good morning, good evening, depends on wherever you are connected from. My name is Emmanuel Adegbola, and I want to welcome you to your popular show, Kina Show. And happy Father's Day to all the dads and fathers out there. So you are welcome to the show. So today I am not alone. As usual, I'm just a co-host. I have my co-host and I have the host. And we have one of the panelists also in the studio. So I'm going to begin to bring them in as they introduce themselves one after the other. So over to you, Mr. Alex.
Alex Wahiri, I'm a co-host, and Dr. Law will shortly be here. He has sent a message.
Awesome. Over to you, Dr. Choma. Go ahead. We can't hear you. Okay. Okay, you can exit, then possibly come back. You can just exit, then come back. Okay, can you say hello? Okay, so you can exit, then you come back. Somebody can type that to her.
Right. I hope you.
Okay, so while she's trying to figure that out, I'm going to be bringing in the host to introduce today's topic. Very interesting topic, very interesting and sometimes scary also, because when you're talking about getting old, geriatric, it's like, okay, nobody wants to get old, but it's not what you can dodge. So join me as I welcome the host of Kina Health Show, Dr. Kina Ominako.
Hello, everyone. Welcome to Kina Health Show. And happy Father's Day to all the fathers out there. I am Dr. Kina Menokor. Today, we are going to be discussing and focusing on a physical and mental and social well-being of the elderly people. It aims in promoting their health, preventing and treating their diseases. We're going to be talking about geriatric syndrome, something that is inevitable. As we get older, our body changes. Whether we like it or not, most of those conditions can be permanent, and we're here today with some health professionals that will be discussing those conditions, and we will be taking your calls. If you have calls to make, we're going to post our WhatsApp numbers. You can reach us. You can text questions. Because I know this topic is one that everyone will be very interested in knowing. And as we dive into ways that we can keep our elderly free from certain conditions that can be detrimental to their health. Welcome to the show again.
Awesome. You are all welcome. So, Dr. Choma, can you hear me now?
Yes, I can.
Awesome. You are in the house. Let the party begin. So can you go ahead and introduce yourself to our audience?
Well, my name is Chioma Ogunedo. I live in Massachusetts, Foxborough town, and I'm a family nurse practitioner, and I deal with geriatric clients.
Awesome. You are so welcome. Sometimes I find it difficult to actually define Dr. Chioma. I find it difficult to I don't think I know your specialty, your area of specialization, because it's like every topic we have been discussing on this show for the past 2 years, you have practically been there, either virtually or in person.
Well, I'm a family nurse practitioner, so Dr. Kina knows what it is. We are from the same stock.
You are familiar spirit.
Yeah.
Okay. Awesome. Okay, so over to you, Mr. Alex, as you start paddling the canoe of today's show.
Yeah, Dr. Choma, you're welcome. We're talking about the elderly, and like you people normally call it, geriatrics. So what is it? What are the who are the geriatrics who fit into this age bracket? And we can go from there.
I would like to from the American Academy of Geriatrics, they look at people from 65 and above as being in that category. But I wouldn't like to box people into a group because you can see these days you can see someone who is 75 and they look like they're in their 40s. So when we're talking about geriatric syndromes, we are going to be looking at people starting from age 65 that are exhibiting some
The line. It's your it's like your internet or your Wi-Fi is misbehaving. So
so sorry, I think
okay,
we had an interruption. So
okay,
we're
good.
talking about people who have delirium, incontinence, that are frail. These are people that we're going to focus on. That we start to look at a geriatric person from age 65 and above.
Okay. Kina?
Yeah, I wanted to throw in,
You first, maybe.
um, can you guys see me?
Yes.
Why not?
Because I cannot see myself. Um, um, so as Dr. Choma has pointed out, um, there is over 703 million persons that are aged 65 and over in the world by the year 2019. And this number is expected to double by the year 2050 to 1.5 billion. And as people age, there are certain conditions, like she mentioned, that are very important to address, so that we can keep these people safe and free from injury and from reduce their environmental risk. So, how do you, Dr. Choma? I know you've been focusing on the area of geriatrics um, in your as a family nurse practitioner. So, what are the most common things that present with your patients?
You might have to repeat the question. She just came back.
Oh, okay. So, my question was, what are the common geriatric syndromes that you see in most of your geriatric patients?
Um, I know that most of my geriatric patients, they come in different shapes and sizes because of how they've been managing their health from childhood. And so when you get to that age, sometimes we have clients that are a little bit confused. Um, they might exhibit to you to be normal. It's only when you start to ask questions that you get the idea, or there's a family member who says she's always very forgetful. Being forgetful does not mean that you've lost it completely. Just I laugh with them and I say, are you having senior moments or is this a problem? So when you start to do detailed account of their forgetful, the cognitive ability, that's when you actually figure out that this person needs help. Another issue is with fall. Um, if you ask them how many times have you fallen in the past 3 months or 6 months, they can tell you 6 times, and then you try to figure out why do they fall. It could be because they're tired, fatigue, very frail. They're not eating well. Nutrition comes in. Other things you can find out from them is like you walk into a house or an apartment or room where she's sitting or he's sitting, and the TV is like they're playing it for that house and the neighbors. And they're like, why is your TV so loud? He said, no, it's not. And the family would be like, he's driving us crazy. He doesn't hear. He's deaf. So those are some of the things. Or incontinence. You ask that question: are you incontinent of urine? The client can say, "No, I'm not." Then he gets up to go get medications, and you see that he's
Dr. Choma's internet is like it's not. So
Working today.
yes, I hope Dr. Tina has to be making herself ready as a backup to continue the conversation.
I know we are having problems with connectivity today. Sorry, it could be the weather. So those are some of the things: incontinence, frailty, um, decrease in nutrition, delirium, um, you know, not sleeping. Those, they come in different shapes and sizes. So I don't know if Dr. Kina has more things to add to it.
Just wanted to add something else. When the patients are frail and their nutrition intake is less, they're more susceptible to pressure ulcers from prolonged sitting because of inactivity and sleeping on the same position. So those are the things to look at for. And in general, functional decline, both physical and in cognitive, and those people not able to participate or carry out their activities of daily living, like their grooming. Grooming is neglected. They're not able to stand for long to cook their meals. Hence, decreased food intake. Another thing that we notice in this population is that fluid intake is decreased, and then so you have to make sure that they're taking fluid intake, otherwise they can get easily dehydrated, and they're also more susceptible to urinary tract infection, which is also one of the main reasons that causes delirium. Urinary tract infection is a very big one on the list because um, it causes those individuals to have delirium confusion. So I just wanted to tag to what Dr. Chama has said already about the syndromes that we generally see.
Also, okay, Mr. Alex.
So these signs and syndromes, it appears the two words can be interchanged, signs and syndromes. Can we use it to evaluate, are they very normal signs, or are they signs, are they signs that are normally seen in every aging person, or are they signs that depict that aging person or geriatric is deteriorating? So what's I want to know. Chioma, please, can you help? Are these normal signs that you will see in every geriatric?
It's not a normal. I would like to use the word normal. What we do as people who take care of
Let me jump in while Dr. Choma is sorting herself out. So to separate the syndrome from
I think I'm having problems with connectivity. I'm so sorry.
I'm
Choma,
praying for you.
Choma,
Go ahead.
why don't you use your phone?
I tried it. It's asking me for all the password in the world. So, so what I was trying to say is that when we get into a person of that age, we do a complete assessment. So you cannot. It's just like comparing Chioma and Kina. We have two different DNAs. We belong. We've lived a different kind of life, and there are things that we've gone through as children, and now we're going into adulthood. So we don't. You don't have you cannot box them all into one, but it's a guide. So when you're doing assessment head to toe, you're asking questions. You're trying to figure out what this particular individual is going through. How is your memory? How is your vision? How is your hearing? You do all those tests. You check especially with hearing. Sometimes when they're playing that TV so loud, as a provider, when you get in, try and check and see if they have cerumen impaction, what you call wax. It could just be ears full of wax and it's blocked, and you now say, oh, he's deaf. No, try, if it's there, either you refer them to their provider, or if you can do it at home, you just help them flush it out, and they'll start, oh, I can hear again. So that's a simple test. You check the mouth. Do they have, how is their dentition? If it's bad and you're asking them, why are you not eating? I can't chew because it's painful. Is it because they don't have well fitted dentures? Is it because they've lost tooth? Is it because their mouth is always dry? Are they having trouble swallowing? So every individual is different. When it comes to pain, you have to assess for pain. Don't just generalize that, oh, every old person has pain. No, some of them don't. And if they tell you they don't just say everyone who is 65 and above has arthritis. No. So you have to do a detailed assessment to figure out exactly what is wrong with this person, or how can I help with this elderly person to be very functional and live independently at home. That's the goal.
Let me add a few things there. I think Mr. Alex was asking, is this syndrome, does it, every person that is 65 and older, do they have these syndromes? What are the differences between the signs of aging and the syndrome? I think signs of aging is very obvious. Most people have fine line and wrinkles. The the skin become dull, and the skin tone is uneven. It becomes more dry, the skin, and there's something called age spots. Some people have the white one, and some people get the black one. So these are some of the, and there is roughness and of the skin texture, and you can easily see that their pores are enlarged or visible, and the elasticity of the skin is very is, so you can see that they've lost the elasticity of the skin. So these are some of the general signs of aging that you could visibly see on individuals. Just wanted to add those.
All right, so we have Dr. Law in the house. So if you could just go ahead and introduce yourself to our audience, and happy Father's Day to you right there.
Thank you very much. Even though I'm not hearing you guys clearly, but I'm Dr. Law Sando with a clinic in Maryland where I am at this time. I appreciate the audience, and we are here again today to let you open your eyes to some of the problems of aging. Thank you, and thank you for accepting me here today.
Yeah, Lord, let me take you off right away. We are at a stage where we were looking at the general characteristics or conditions or syndromes of people that are aging. And I'll ask the question which they are still battling with. And that question is, there were a number of factors they reeled out, and I was asking, are these factors generally seen in every aging person, or are they seen in some people, and does that depict a sign of deterioration of somebody's health? And Kina has added another very interesting aspect of some of the conditions and signs you see in an aged person. And some of them are very obvious. You see them and they are not very pleasant. And so we will also want to know whether can you avoid such conditions, because there are people who are old and still looking good and looking fresh. And a lot of people will want to know how you can go about this. So can take it off from there.
Did you get the question?
He's frozen.
Okay, so Dr. Choma, you can just pick it up while we're waiting for him. Did you get the question?
Well, I think the question was directed to Dr. Law because he has not been in the conversation and it's one that we've already treated. So don't know what's happening to two of them today.
Okay, so we can just skip the question and go to the next one, and when he comes back, we can just continue.
All right, but
Okay, can I go ahead?
yeah, is Dr. Sharma? Can you hear us?
She just exited also. I guess we will reconnect.
Okay, so the next question that is do the geriatrics get more tired than ordinary people? Dr. Choma, are you back?
I'm back. I'm using my
Okay. Do they get more tired?
yeah. A lot of them complain of fatigue, and it's just because of we've talked about it. All the things that happen to us as we age, we are like cars. We've been driven for so long, and right now, some parts needs to be replaced. Our food intake is less. Our fluid intake is less. We tend not to have the same energy as we used to have before. Like for some of us, we do 5 miles a day as exercise. As you start to age, you slow down. You should know your ability to do such things. But yeah, I think I will answer emphatically, although some people would like to prove that they are stronger than younger ones, but yes, they feel more tired than younger people. I hope I answered your question.
Can I throw in this question to Dr. Choma while we're waiting for Dr. Law? So we're talking about geriatric, as I said in the introduction, that is one of the scary topics because practically nobody wants to really get old, even though it's unavoidable. So how does your lifestyle affect all these signs that we're talking about? How does your lifestyle when you are younger, how does it affect, the signs that you display?
Um, for instance, let's take someone who is not used to exercising as a young person. So as you're getting old, you had a sedentary life. You're always sitting, doing nothing. As you get older, you feel more tired. You can't do anything. So like Dr. Kina pointed, you're always sitting, you start to have pressure sores. You start to have all kinds of aches and pain. Your muscles are tired. Your bones are cracking up. But if you're someone who, as a younger person, you use your body the right way. You exercise. You eat the right food. You move. You use your brain. You do brain exercises. I'm telling you, you will see a 90. I was privileged to be with a 98-year-old woman on Friday, and this lady, she is as smart as a. And I said to her, when I grow up, I would like to be like you. And she laughed, and I meant it because she thinks in herself, to do things. She can warm her food. Her kids will bring the food, and she'll warm it in the microwave and eat. She still picks up things in her house. She said, if I don't use it, I will lose it. And that's something all of us should bear in mind as young people. Use it so that you don't lose it.
All right. Well, before we continue, I know it's a special episode of Kenight Show. This is our Father's Day. Once again, we would like to wish all the fathers and potential fathers out there happy Father's Day. While we are waiting for Dr. Law to come back to the studio, we just want to say happy Father's Day.
Today is your day. Enjoy your day. Happy Father's Day. Happy Father's Day.
I'm so grateful for the gift of life. I love you so.
Papa, I'm so grateful for the gift of life. I love you, son. Happy Father's Day. Papa, there is your day. Enjoy your day. Happy Father's Day. Happy Father's Day. Papa, there is your day. Enjoy your day. Happy Father's Day. Happy Father's Day. Happy Father's Day. Happy Father's Day. Thank you for protecting. Happy Father's Day. Happy Father's Day.
All right, Mr. Alex, over to you.
Mr. Alex, before you continue, Mr. Emmanuel had asked a question about the lifestyle that one lives. Does that have, how will that affect as you age? And I wanted to add a couple of things. Smoking is one of those things, many people do. Some people that smoke, we know that smoking, there are toxins in the cigarette that exposes the skin to oxidative stress. So smoking, in several ways, it affects both your cardiovascular system, your skin. It causes dryness and wrinkles, and actually causes faster aging. Exposure to sun and tanning. Again, naturally, our genes, some people have better genes than others. You can see the same people, the same age, and some people are looking more fresh than others. Sleep habits. So if you have been sleep deprived most of your life, sleep is a very critical part of our well-being. As you sleep, the cells refresh and regenerate. So poor sleep is connected to increased signs of aging, and it diminishes the skin barrier and affects the functioning. Diet. We've talked about diet almost every show we have had on Kina Health Show. You cannot underestimate what diet does to the body. If you're eating foods high in sugar, refined carbohydrate, over time, your skin is more susceptible to damage over a period of time. Alcohol and caffeine intake also dehydrates the skin, and it makes the skin to be more saggy or loose over time. And of course, there's other environmental factors that affect aging due to the pollutants in the air, and then stress. A stressful lifestyle can trigger a lot of inflammatory responses in the body and interfere with sleep and so many other things, and that affects how we age as well.
Yeah,
Just to,
Dr. Kina.
sorry, Mr. Alex, let me quickly, before I forget this question, sorry. I want to direct this question to Dr. Kina, or Dr. Choma also can just back up. You made mention of a sleep, right? I don't know if you are the one I was discussing with someone, or maybe you are the one, that many people don't have a regular sleep pattern. So how does that actually affect our growth process? When you don't sleep properly, how does that affect your growth
Is it growth process or aging process?
Aging, yeah, the same thing.
Growth and aging. Well, I think we had the discussion on one of our shows, because sleep is very necessary for younger kids. As they grow, they need sleep, because some of the hormones function and work better while we are asleep. So I think we've gone through that. But also, as we sleep is important for everybody, young and old. If just try not having a good sleep and see whether you will function the next day. As we sleep, the cells regenerate, they refresh. So sleep deprivation is we've talked about how it can cause some mental health issues as well. So sleep is very critical. Dr. Shoma, I don't know if you want to add something to that.
Yeah, the only thing I wanted to add to it is that sometimes we think about sleep. How many we are thinking about going to bed at night. Some people sleep during the day. So the question is, how many hours of sleep do you get in a day, in a 24-hour period? Because most elderly people, they nap during the day, and they will tell you, I sleep from 2 to 4. So if I add 2 to 4 and the person watches TV till 10 p.m. and then goes to bed at 10 and wakes up at 6. So if you calculate that amount of sleep, because the last time we had the show on sleep, we talked about 6 to 8 hours of sleep is okay for them. At the point that you start to age, you don't sleep that much. But at least if the person can get up to 6 hours, that will be fine. It will regenerate your cells, like Dr. Kina said. You will think better, you will function better. You won't eat people up when you wake up in the morning. And another thing I wanted to point out to you is that elderly people who worked nights all their lives, especially nurses, when that time comes, they don't sleep at night. I have gone to people who say to me, I vacuum clean at night and I wash dishes at night. I do my life. I'm like, what kind of life is that? But when you start to pry into their lives, you find out that they've done 12-hour nights all along. So the question is, how many hours of sleep do you get in a day? And if they're not sleeping well, then they need to see their doctor who can prescribe or even do sleep hygiene. You can use that opportunity to talk to them about what we call sleep hygiene. Do you have TV in your room? Do you have any distractions in your room? Do you drink alcohol before going to bed? All those little things you teach them is not good for you. You have to be relaxed, in a relaxed mode before it's time for you to go to bed. I hope we answered your questions.
Yes.
Okay, and I was trying to draw attention of Dr. Kina to a question I asked Dr. Law, which he did not, network has not allowed him to answer, and that is, we have painted the scenario of the characteristics and features of aging, and some of them are not very pleasant, and somebody is asking me, can this be ameliorated? Is there a way in which some of these scary conditions can be reduced or can be ameliorated, and must everybody continue to looking ugly towards the end, or is there a way you can slow it down? Is it possible?
Well, yes, it is possible. And we're going to go back to the same thing we've been talking about all these months that we've been on the show. Cut down your sugar intake. Eat more fruits and vegetables. Avoid smoking. What are the things that caffeine, foods high in sodium, alcohol, sugary drinks, sodas, just those good old things. There are some vitamins and supplements too that are recommended, for elderly people. But like Mr. Emmanuel was asking, what can the younger generation do? They can do all these things that we're saying. Exercise. I was privileged to do some work a couple of years ago, and it was doing in-home assessment on elderly population, 65 and older. And I realized as I go from one house to the other, you can pretty much see how one lived, their lifestyle, what they did when they were younger is actually what's taking them through life as they get older. The bad habits like smoking, alcohol, if you have been doing those all your life, then one, you're decreasing your life expectancy. Two, things in your body will start not being as well as for somebody who was a vegan, that ate vegetables, didn't eat any meat all their lives. You can just see these things. Again, there are so many other factors too. The gene, environment, how stressed were they throughout their lives, and so many other things. So yes, Mr. Alex, if you look at the general population, and I'm sure if you look at people from day to day that you work with, you can see some people who look younger than their age, some people who look older than their age. But when you tie it back to, how they have lived, or they might have some medical conditions too that is causing, the issues of, how one is looking at any as they get older. So
So while we are at that, let me quickly ask this question, and it's one of the questions we have here. That was the number 11. I don't know if I'm jumping, but number 11 question we have on our synopsis says, what makes one age faster? So I guess I will redraft that question. What are those factors that could make one age faster? You talk about some looking older than their age and some looking younger than their age. So what are those factors that could make one age faster?
I think Dr.
I
Kina
think I've
That's
went
what Kina answered just now.
had it.
smoking, exposing yourself to sun, tanning, gene. There's nothing you can do about your gene. Sleep habits, your diet, alcohol and caffeine intake, and other environmental factors. Stress is the number one thing that affects our body in such a negative way, causes so much inflammation in the body that can make our body age faster.
So what role does the so-called anti-aging supplement, anti-aging drinks, anti-aging capsules? So what roles do they play in all of this?
You know what? There's a question that Mr. Alex asked, and you're asking the same question in a different form. I don't think people be afraid of aging. Aging is something, a process that we must all go through. I don't think I want to be 20 anymore. I like where I am. So, but what we should do is, how do I live at this age, and how will an elderly person live at that age? From 65 and above. So, anti-aging, I don't believe in those things, because I've not seen anybody who was 150 that is now 40. It's a way to make money, and people are making money off of it. But rather, supplements are good, like Dr. Kina mentioned. Vitamin D, if you guys remember the last show we had, that Dr. Lawson mentioned that majority of us, when we go to our doctors and they check our vitamin D levels, is abnormal. So what can you do? Just get some vitamin D and take that. Take some multivitamins, because as you age, there's no way you can get all the vitamin C's that you need from your food, all the vitamin E's, the quinoas, whatever that is in multivitamins. So supplements are good just to help you. But for you to reverse your age, I don't think we've reached that point. All of us will get to where we're going, no matter what you do.
Are you sure? Because I'm actually looking for one.
Yeah.
I really need one.
Have you seen people who did, the ladies who did eyebrow when they were younger? The eyebrow now is on their forehead.
Yeah, sure, so don't make me laugh.
Yeah.
So what you are saying in essence is that no matter what foundation you put on, how beautiful the wig could be, it doesn't reduce how aging you're going.
Well, let me add to that. In as much as aging is a normal phenomenon and we all have to go through it. There are things that are called antioxidants. The antioxidants, and that's what we get from fruits and vegetables, and that's why we hammer eat your fruits and vegetables, because the antioxidants, what they do in the body is they help to get rid of the free radicals and the toxins, which are the things that causes the cells to act the ways that they are not supposed to act, and they help in causing diseases and help in quickening the aging process. So this what you had asked is anti-aging. So those are what they have in most of those creams and supplements and IV therapy. Is they boost. There's a specific one, glutathione, which is very good. That helps. And vitamin D is critical because vitamin D and some other vitamins help for the glutathione to be optimized in the body, and it helps with cleaning out the body from toxins and free radicals. And when your cells are healthy, then things work better, your organs work better, things function better, and it reduces the stress in the body, and it helps with, if you may, helps you from preventing diseases, and to, I'm sure in a way it helps with decreasing the aging, how quick or how fast you age. So I think in a way, some of those anti-aging have certain supplements that they call anti-aging um, because of the things
So
that
if,
they
if
have.
I understand English very well, anti means against.
That's what I'm saying. You know what, Dr. Kid, I try to make Mr. Alex feel good and pass no matter what you age. So how do you manage aging? So yes, she has said all that, big grammar, like you said, Pastor. But it's good for us to keep alive, healthy. But when, like Mr. Alex said, ugly, ugly aging. Aging is not ugly. We love our grandmas; they're beautiful. We love our grandpas, and we are praying that they remain healthy by eating right, sleeping well, going to their doctors.
And
As for
exercising.
isn't. That's the big thing. As for all those supplements, like I see there are some that they put and they say wrinkle, and the wrinkle is still there. So they use to close up the wrinkles, give themselves injection on the face and all the rest. I mean, if you have money, you can do that. But if you don't, please live and be well.
And let live.
So I see that we still have a lot of questions, but just to, because of our time, since now you're talking about a lifestyle for geriatrics, so let's just talk about exercise. So what kind of exercise will you recommend for geriatrics?
But we have questions from the audience. Can we take those questions?
Yes, sorry, I actually saw that I wanted to
We have
bring
two
it up.
questions.
Okay.
Yes, so we have these questions that says, I have a question. I'm in US. Are the elderly in countries like Nigeria, where they have families around them, as opposed to in Western countries, can having family help the elderly? I didn't really understand that question very well, but I guess
It's just asking whether
Yeah.
do they face the
Family
same
support.
challenges
Yes,
since they
yes.
have the family people around them like the elderly that is facing here.
The one thing I find out dealing with geriatrics in this country is that loneliness is a big problem. Loneliness. Back home in Nigeria, where we have a community kind of living, you wake up in the morning, you go into your grandfather's house. Grandpa, how you doing? Grandma, how you doing? We don't have the resources there, but the community helps a lot. We make sure they eat. I've never seen any person when I travel to Africa, and you're allowing your grandma who is 98 to be cooking. The children cook and feed them. The children take them to church or sleep with them at night. Someone is there. But here, there's so much isolation that when you come, depression sets in. And what they tell you that my kids are not around. They leave. This one lives 6 hours flight away. The other one lives 4 hours. They call me like once a week, and they try to justify it by saying, they all have jobs. So what I'm trying to say is that yes, back home, much as they don't have facilities and money and all the things that we have here, they have a healthier life because they go out, they have meetings, the younger people take care of them. But here, loneliness leads to depression, and depression is a terrible thing for the elderly. So they end up either taking them to nursing home. If the person refuses to leave their homes, they tap into the system and see if they can get them home attendants. I know they've cut down hours to 2 hours, 1 hour a day, or 3 times a week. But adult daycare is another means of taking care of these people here. So yes, our community helps in Nigeria. Thank you.
Okay. Does anybody have anything to add?
Yeah, the only thing let me just say that what Chioma just said is the truth, because the company our aged parents have at home, I think, compensates more than 50% of the lack of facilities and lack of other things. Because the critical thing among somebody who is old is, can somebody talk to me? I need somebody to talk to. Is somebody coming into my room? Am I lonely? Am I staying alone? Could they have wonderful company? Wonderful company. I think that compensates for the absence of so many other things.
Awesome. So, see Rita Wairi is asking for anti-aging. So I guess Mr. Alex will have one.
Alex has that formula. So
well, Kina has already answered that question very adequately. And so I'm sure she was excited with what she had,
Yes.
and she will make contacts later.
Awesome. Over to you, Mr. Alex.
Okay, so we have already begun to treat the next question, which is what are the major problems of geriatrics? Is there any other problem except from company? Do we have other problems here? We have identified a very major problem, company. Do we have other problems from those of you in the field?
what do you mean company?
I said we have already talked about companionship for them.
Yeah.
And I'm saying, do
Other
we have
problems?
other problems for the geriatrics?
There are a lot of problems.
There are a lot of, yes.
Yeah. One is how to tap into resources, especially geriatrics that are not in this country. If they have a language barrier, they need to tap into resources. So your job as their provider is to find them a social worker or case manager who can, because one thing with geriatrics is that they need a holistic approach. They need all the providers to speak to one another so that they know what A is. The cardiologist knows what the primary care provider is doing. Primary care provider knows what the urologist is doing. So you don't analyze care. So we need them to be in one pot and take care of that person as an individual. Find things that they can do. Like we talked about loneliness. If they're lonely, find them adult day program where they pick them up in the morning and bring them back in the evening. If they're incontinent, try to get them incontinence supply. Some of these people have lived good lives. They hate when you come into their houses, it's smelling of urine. But there are ways you can help them by getting them incontinence supplies. Insurance companies are paying for it. Another thing is nutrition. There are some places like here in Massachusetts, we have Meals on Wheels, we have fresh food, different things that bring food at least 5 days a week for these people. And what they do is on Friday, they give them double meals for the weekend. Exercises, if they have something like YMCA gives them a discount for aqua zumba and other kinds of exercises. If they're in pain, your doctor will recommend physical therapy, which will be done in the house. So I think what we need to do as advocates for these individuals is that when you see them, try to get them the resources to live a healthy life at home.
All
Do
right.
you have other problems? Is this
Yes,
exhausted?
yes. Another thing, because she has mentioned, because they have the as we start aging, the organs start failing. So it's very necessary they have multiple appointments. So they need resources also to make sure that they get to their appointments. And because of all the COVID morbidities, COVID morbidities and the of the conditions, they are more inclined to have polypharmacy. This is where they have multiple medications. So that alone can cause its own problems. So if they're taking multiple medications that they are counteracting themselves, it can give them dizziness. So they are more you may see falls because of the certain medications. So it's very critical. As a matter of fact, it's a specialty, geriatrics. There are some doctors and nurse practitioners specialize in geriatrics because there are special um, special age that there's so many medications and they have to be managed properly. And that's another area when they get to that age, is that they may need skilled nursing in the home to sort out their medications, to set up their pill boxes so that they can remember to take them, and monitor for problems that could come up with having polypharmacy. So I wanted to add that. And if they have mental health issues, um, and that's another referral and another area that counseling and all of that will be very necessary.
So, talking about polypharmacy, I believe we have one of our questions that says, is there any relationship between geriatrics and polypharmacy? So then what is polypharmacy actually?
Multiple medications.
Okay,
That's what
poly.
what multiple. So, for
Okay.
instance, you're a doctor. Alexis said, Dr. Kina is a provider. I'm a provider. They come to me, I prescribe 2 blood pressure medicines. She goes to her friend, tells her that Dr. Kina is the best. Dr. Kina provides another one. Like that. You see someone with 10 pills for what it is, and then the other things, and they're now counteracting each other. So what we are saying is that the nurse, skilled nurse in the house, can call the providers and say, we need to deprescribe. So at that point, are these medications actually beneficial? If they're not beneficial, you take them out. And if the blood pressure is normalized, just, hey, let the person live at 85. Come on, why are you giving me 10 pills? So we need people to advocate for these individuals so that they're not taking 10,001 meds. You go into their homes, they bring out medication in a shopping cart. It's not normal. So what we need to do is to, like, sometimes you see them, oh, I'm taking this vitamin, that vitamin, so vitamin D3 and calcium plus vitamin D3. I said, these are all medicines that are doing the same thing. So we need to deprescribe and let them live a free life, taking the right medicines. Polypharmacy is not good even for young people, not to talk of for elderly people. Your organs are not flushing out things again, so reduce the amount of meds you're taking, but with your doctor's advice.
Wow. Over to you, Mr. Alex.
So, arising from all this, you may have touched it, but what will you say is the best method to handle these geriatrics? What are the best methods? They are very complex. They have failing health. Yeah, you can't easily remove some of their medications without upsetting them. So how do you really handle them? Because they're very delicate. They pick quarrels sometimes very easily
Oh,
because they may not understand what they are doing.
you have to do it with the family member or their best friend or someone they trust. That's a good thing, that if you build relationship with your primary care provider, some of them listen to you. They will say, when you tell them, these medicines you're taking, they're almost the same thing. Can we take it up and see what happens in the next week? You have to give them short-term goals. You don't make it like projection for years. if they have that trust in you, they will accept. Sometimes they also stop taking it. That doctor wants to kill me, or that provider wants to kill me. So you have to now tell them, no, I'm not trying to, but I'm trying to make you healthy. So you have to have a relationship with whoever you're treating. Mr. Alex, as you get older, uh, and they prescribe for you. I know a lot of people go on WebMD, which is not the best thing to do too. Just have a relationship with your provider and talk about it. Ask them what. Most of my clients, I'll say, "Do you know why you're taking this medicine?" No, he just gave it to me and I'm taking it. I said, "No, I'll call and I say, why did you take this medicine?" So I like to be the advocate in the house at every point in time, and I hope all of us will gain from that today.
Yeah, Choma, before you back out, now the medication system I saw here is quite different from what happens at home.
Uh-huh.
At home, you go to the hospital and you are treated. You are given a specific number of medications, and when you finish taking it, you don't go back. You
That's right.
start living your normal life. But from what I see here, you go to refill. In
Yes.
fact, as you are being given the thing, you are given a refill about 2 or 3 times.
Mm-hmm.
And some people are on permanent refill forever. So what's going on?
Okay.
Because they need to make money. They need to make money.
Yes, we don't have money. We have talked about chronic diseases. There are things. Let me use the word that you
Even if it's not chronic, Dr. Chama, they'll make it chronic for
no,
you.
they don't. But me and Dr. Kina will object to that because we're in the field. We have to go to healthy. So back home, there are diseases that they say is obrinaja. That's you will suffer from it till you die. So the problem we have back home is that the doctor writes atenolol, 25 milligrams daily times 30 days, but does not follow up to say it's for 30 days, come back for a reassessment. There should be a reassessment to see if I'm going to decrease and or am I going to taper you off of the medicine. That's what we practice here in the United States. So it's not that you're in forever refill, unless if it's a chronic disease. For instance, someone who has HIV will be on chronic refill because they're not going anywhere. But if it's a disease that, yes, you can put in remission, like we're talking about diabetes now, they can say, okay, let's start tapering down. So, Mr. Alex, please, when you're talking to people back home, tell them to go and reassess with their provider. It's better to be alive than to be dead. Thank you.
Let me add to what you just said, Chioma. Mr. Alex failed to realize that back home, the doctors are the ones dishing out the medicine, so they want the person to come back. So how will they now give you a refill? They will only give you enough that, if you only have a certain amount of money to cover for 14 days, you will just take the 14 days and you're supposed to go back to him. He's a doctor, he's a pharmacist, he's everything.
It's a
So,
lamb.
and because they don't trust anybody else to be refilling those medicines because somebody else is going to take their business, so they don't put refills, and sooner or later, things are going to change in Nigeria where, they will start practicing, exactly what they went to school for, rather than, just being there to extort people financially.
Wow. Well, what else can I say? It's been a wonderful, wonderful show for the past 1 hour. It's special Father's Day's episode talking about geriatric syndromes, and I believe a lot have been discussed. So what you can just do to actually pass this message across is to like this video if you're watching on YouTube, and make sure you share with somebody. This could be the best Father's Day present that you could give to somebody. Just, it doesn't cost you anything. Like it, share it, because trust me, these informations are very, very vital and somebody somewhere needs it. So, as usual, we normally like to just tidy it up and do what we call the take home. I know our time is fast spent, but Dr. Choma, if there is any summary you could give in just 30 seconds, how will you summarize and what will be the take home for our audience today?
The take home for any person who has a geriatric family member or who is geriatric that is watching this, learn to take care of yourself. Be your primary care provider. If you have any problems, deal with it at once, because if you don't, it deteriorates and it gets worse. So be well, be healthy, use it, don't lose it. Thank you.
Awesome, awesome. And Mr. Alex, what would you say your take home has been for today?
Well, my take home is that I will take it from what Kina released today. What you are today or tomorrow depends on how you organize yourself today. Your lifestyle today will determine what you'll be tomorrow. It will determine how you will look, it determines how strong you will be, and it determines how healthy and how robust you can enjoy your life. So you eat well and eat healthy if you want to enjoy your old age.
Awesome, awesome, awesome. What a privilege to be part of today's show. I posted a video on a Kinite Show WhatsApp group about, I think, last 2 weeks, where Pastor Matthew Ashimolo was asked, is 70 going to 71? And he was asked that what has he been doing to make him look so fit at 70? And he faced the audience that asked him that question. He said, "Do you really want to know?" They said, "Yes." He said, "Are you sure?" They said, "Yes." He said, "Well, for over 20 years, he has stopped eating rice, fufu, stopped drinking anything that has to do with sugar. I mean, he exercised regularly, and everybody was just looking at him." Honestly speaking, everything we have been discussing, irrespective of disease process or name, everything falls back to what Kinai Show has been evangelizing for almost 2 years. Change of lifestyle, what you're eating habits, what to do, your lifestyle, everything, everything, everything. Anyway, I'm going to hand over to the host as she tidies up today's show. Once again, my name is Emmanuel Adigbola. It's been my pleasure to co-host today's show.
Thank you, everyone, for watching. It's been another wonderful show. Geriatrics are a special population, and sooner or later, we will all be there with them. So, the best thing to do, for us to do, and as I talk to the younger generation, it's been the same thing we've been, discussing for the last almost 2 years, about changing lifestyle, eating well, exercising, drinking plenty of fluid. But most importantly, let's take care of our geriatrics. Let's take care of our aging population. A lot of people are living a whole lot longer than before. They are looking a whole lot healthier, and they are functioning more. So let's provide for them. Let's show them love. What most of them need is actually companionship and love. And let's love all ourselves. And thank you again for watching. If you have any questions or concerns, you may reach us at the number that is showing on the screen, and we will take care of you, your family, and your grandparents. Thank you, and we'll see you next show.